January of this year, and I think very important that we acknowledge and celebrate what was quite an extraordinary life. So he was 89 years of age, and as you will all know, was a French cardiac surgeon who actually trained both in cardiology and surgery. Not something we think you could perhaps do now. We'd be happy to do a little bit of surgery on the side, Eve, but probably not possible now. He was the head of cardiac surgery at the University of Bordeaux. He had really a remarkable career. He was involved in a lot of the early work in France, did the first sending operation, and was involved in the transplant program there as well. And one of the things he was most proud of was the establishment of the European Association for Cardiothoracic Surgery, and that organisation is ongoing, and in fact he has funded the Francis Fontan Fund for Education, so he also had a great interest and passion for lifelong learning. But of course, the thing for which he is most well known is the operation that bears his name. And the story, and I won't go into great detail this morning, but the story is quite a remarkable one, really. Dr. Fontan had done some experimental work in the mid-1960s, and that was work on dogs, actually, connecting the inferior vena cava to the pulmonary artery, and that work was largely unsuccessful. And so quite remarkable that he went on to introduce this operation into clinical practice, and this paper, well, in fact the work was initially published in French, and then this paper was published in 1971 and reported 3 patients who had this so-called surgical repair of tricuspid atresia, and as you can see from that diagram, the original Fontan looked a little different to what it does today. But 2 of those patients did very well, and of course within a fairly short space of time many people were having a Fontan operation. And so his legacy is quite an extraordinary one. We've seen the evolution of this operation over a nearly 50-year period. There have been a number of modifications such that the surgery is now safer with better outcomes, and it is remarkable to think that from those 3 patients reported in 1971 that there are now 50,000 Fontan patients in the United States, over 20,000 in Europe, and of course 1,500 people on our Fontan register. So a very remarkable legacy, and I think we should acknowledge and be very thankful for what was a remarkable person and a very remarkable career. We're going to hear a number of talks today. The Fontan Partnership and Registry, of course, continues to be very active in the research area. I've mentioned a number of current projects there, and we'll be hearing about those later on today. I won't go into detail right now. You all have a program. It's quite a varied program with some very exciting talks, and I'm certainly greatly looking forward to that. Most importantly, we're going to hear your stories, so patient and parent stories, and that really is the aim of the day, is for this to be very interactive and not dominated by old cardiologists. We're going to hear from Heart Kids as well. We're going to have some workshops this afternoon, and again, they're going to be about a conversation, really, and about hearing your stories and what's important to you. Sometimes these talks can be a little bit confronting, and so there may be some information that some people might find a little upsetting, and so it's not the intention to offend or upset, but there are also some things that it's very important for us to have a shared understanding of. And if anyone is feeling uncomfortable at all, then I would encourage you to talk to us about that. But mostly, I think this is it's a happy day, this one, and I fully expect that that will be the case again today. And really, this is about education for us all, and I'm certainly greatly looking forward to hearing the talks and to talking to people through the day. I think it's a wonderful day, and there's something here for all of us. So with that, I will hand over and introduce Andrew.